The transfer of embryos that have been previously frozen or vitrified is a relatively simple process. In most cases, a single good quality embryo will be recommended for transfer. Prior to the transfer cycle, it will be important to meet with your provider to discuss the cycle plan and to determine the method to prepare the uterus. You will also need to have a recent uterine cavity evaluation, such as hysterosalpingogram, HSG, saline infusion sonohystogram, SIS, or hysteroscopy. These are simple outpatient procedures usually performed in the first half of the menstrual cycle. If there are any polyps, fibroids, or scar tissue present, you may be recommended to have a minor surgical procedure to remove these prior to your transfer. In some cases, a sample of the uterine lining or endometrial biopsy will also be recommended. Depending on your clinical situation and menstrual cycle status, your provider will recommend a protocol to prepare the uterus for transfer. There are 3 types of uterine preparation: a programmed medicated cycle using hormone replacement therapy, or HRT, to mimic a normal menstrual cycle, an unstimulated natural frozen embryo transfer, FET cycle, or an ovulation induction FET cycle using medications to induce ovulation. Each of these protocols have similar results as long as a normal endometrium develops and the timing of the transfer is synchronized properly with the embryo development. Programmed, medicated, or HRT protocol. In this cycle type, the uterus is prepared for transfer by first giving estrogen and then progesterone to mimic a normal menstrual cycle. Ultrasound and hormone blood tests are performed to ensure normal endometrial development and hormone levels. Depending on the stage of the embryo transfer is scheduled on a certain day of progesterone administration. In this cycle type, the day of transfer can be manipulated and scheduled in advance. The medications are typically a combination of oral estrogen tablets, vaginal progesterone suppositories, and intramuscular injections of progesterone. An unstimulated, natural, or modified natural FET cycle may be an option for women with regular ovulatory menstrual cycles when the exact date of transfer does not need to be planned in advance. The cycle is monitored with a combination of ultrasound, hormone levels, and sometimes urine ovulation testing to determine when a mature follicle and uterine lining are ready for ovulation. A single injection of human chorionic gonadotropin, or HCG, may be given to prompt ovulation, and the transfer is scheduled about 1 week later. In most cases, a progesterone supplement administered vaginally will be given to ensure optimal support for embryo implementation. For women with irregular cycles, medications such as letrozole, clomiphene, or a follicle-stimulating hormone, FSH, may be given to induce ovulation. This cycle type is otherwise similar to natural cycle FET. On the day of your embryo transfer, you will be asked to arrive at the clinic with a full bladder so that transabdominal ultrasound can be performed during the transfer to ensure optimal placement of the embryo. Most people will not require anesthesia for this simple procedure. This discomfort level is about the same as a pap smear. In some cases, you may be given a medication such as Valium prior to the procedure to help you relax. The embryo is placed into the tip of a soft catheter that is then guided through the cervix to the upper part of the uterine cavity where the embryo is gently injected. After the transfer, for peace of mind, you may wish to avoid strenuous activity for a couple of days, but you can otherwise resume normal activity. There is a small chance, less than 5%, that the embryo may not survive the thawing process. If this happens and another embryo is available, it can be thawed and still transferred the same day. If you have normal cycles and are not using hormone therapy to prepare the uterus, abstain from unprotected sex during your transfer cycle to avoid getting pregnant naturally, which could result in twins. 2 to 3% of the time, an embryo may divide after it is transferred, resulting in identical twins. A pregnancy test can be done several days after transfer. If you are pregnant, you should continue all hormone medications for the first several weeks of pregnancy. An ultrasound will be done 4 to 5 weeks after the transfer to make sure the pregnancy is developing normally before you transfer care to your obstetric provider or midwife. Our goal is to help you find success and prepare you for each part of your journey. We hope this provides more information about the frozen embryo transfer process that you can refer back to at any time. Please let your care team know if you have any questions.